Dr. Pauline Tully.
Minister, what level of expenditure for new developments, excluding funding for carryover and otherwise maintaining existing levels of service, have been allocated to Cavan General Hospital in 2024?
Deputy, thank you very much for the question. And can I assure you that I am fully committed to the development of Cavan General Hospital and indeed to our regional hospitals right across the country. When I received your question, Deputy, I asked for a note on the recent investment into Cavan Hospital. It's all well and good me saying what might happen in the future, but it's important that I wanted to establish that real investment has been happening over the last few years. And I have to say the response is very encouraging. The budget in the lifetime of this government has gone up by €16 million for last year. Full budgets for next year obviously will be agreed through the National Service Plan. Probably more importantly, Deputy, since 2020 there has been an increase of nearly a quarter in the workforce. To me, that's always the most important bit, because it is healthcare professionals obviously ultimately who treat patients, and that equates, Deputy, to 259 extra staff in Cavan Hospital, which I think is a very clear commitment to the future growth and investment in Cavan Hospital. On top of that, Deputy, you'll be aware that there are a number of capital developments in progress, which I think are going to be very important. One you'll be very aware of is the new 3-storey extension block. That'll house a new endoscopy unit and an 18-bed ward. That's currently at detailed design stage, and I want to see that progress. I think that'll make a big difference in terms of patient care in the area. Recent initiatives and service expansions also include the establishment of a new medical assessment unit. The feedback we're getting on that is very positive, and further development of the geriatric assessment unit. This is something actually we're rolling out across the country, and the feedback around the country is has been very good on this in terms of ED avoidance and receiving the appropriate care locally. Following the announcement of the budget allocation last year, I issued a letter of determination to the HSE. That kicks off the process for the National Service Plan, and the detailed answer to your question in terms of 2024 and the hospital will be available through the National Service Plan.
Thank you, Minister. And I mean, it goes without saying the staff in Cavan General are excellent, but they are under pressure. And I know you've said there's been an increase in the number of staff, and I appreciate that, but there's also been an increase in the number of people using the hospital. And, there's a lot of insufficient frontline staff. I mean, in particular, I'm talking about therapists. I was talking to a therapist recently. Her caseload for one day was 30 people. I mean, that's not achievable. And in the end, because there was only 2 doing the job and they were each facing a caseload of that, she ended up quite ill herself and had to take time off because she just became worn down. I mean, it's obviously facing issues like all hospitals are now with high flu and COVID numbers, and there have been advisories issued to stay away from the AD if at all possible. And I'm concerned about that because I know they don't mean people who are genuine emergencies, but people are actually afraid to go to the ED when they really do need to go. So, I mean, if something can be done to alleviate the number of trolleys, and alleviate the overcrowding in the ED, it would be very welcome. Morale is quite low, and I mean, I would have talked to staff who say that they feel they are under pressure and that it can be dangerous for themselves and patients if there aren't sufficient numbers of nurses on wards, for example. Also,
Deputy, with regard to the emergency departments, I'm sorry I don't have the figures here for Cavan, but what I can say is last year we moved to an all-year-round approach to urgent and emergency care, getting away from this annual cycle of winter plans. And to the great credit of our healthcare professionals, what we have seen is a very important reduction. I'm not for a moment diminishing the fact that the numbers are still way too high, and in some emergency departments, in some hospitals, they're under huge pressure. About 7 hospitals account for about half the number of patients on trolleys, and I'm sorry that I don't have the Cavan figures here. What I can say is that what our healthcare workers achieved was a 22% reduction for the second half of last year versus the previous year in terms of the number of patients on trolleys. And for those most at risk, the over 75s who were there for over a day, the number has fallen by nearly 40%. So we're by no means where we want to end up, but thanks to important work, things are getting better, and I might ask the department to revert to you with a note on the figures for Cavan Emergency Department.
I know from meeting with the management, I mean, they are very proactive and trying at all times to, alleviate pressures. But I mean, I sometimes will have constituents contact me and saying that they have an appointment maybe in 6 months for a hernia or something. And then when I talk to them further, it's actually only an initial appointment to see the consultant. So that doesn't take into time that they're going to have to wait on a waiting list for an operation. And that's too long. Now, some of them will end up taking the cross-border directive, and using that. But they shouldn't have to do that. And that can place a financial pressure on them as well, because they have to pay up front for that. I know they will get the money recouped to them. Another lady came to me and she was threatened with a miscarriage on a Friday. She was just over 3 months pregnant. When she went into the hospital, it was Monday before she could be scanned to establish if she was having a miscarriage or not, because there was nobody there, no sonographers to operate the machines over the weekend. And she wasn't the only one. She ended up having a miscarriage. Another lady who went in with a bleed ended up, her baby was safe. But it's terrible to have to wait a whole weekend to establish that. That's not okay. And she made the point to me, if men were having babies, that probably wouldn't happen, because she just feels, that she didn't get the care she deserved. Sure. She was even, examined in a room that wasn't a ward. It wasn't even private. It was a storeroom of her mother.
I'm not familiar, obviously, with the case, but it doesn't sound right. We are moving. We're in the middle of a very fundamental shift in healthcare provision to exactly the situation that that woman found herself in. We are moving from a 5-day-a-week service to a 7-day-a-week hospital service. Now, of course, the hospitals are open at the weekends, but to exactly this point, all of the services aren't always available at the weekends. The new consultant contract is part of that. The hiring of 25,000 more staff is part of that. It takes time. It's a huge shift from 5 days to 7 days. But it is absolutely essential for all of the reasons that that lady that you've just described seems to have experienced. So certainly, Deputy, rest assured, we will continue investing in Cavan Hospital. We will continue growing services, continue growing the workforce, and seek to move to 7 days a week and achieve 7 days a week, so that patients can get the services they need. Like you say, people need that kind of care 7 days a week, not just 5.